Recommendations about what we think some additional investments in building the evidence base might be. So, starting out with why we did it, I was trying to remember how it all got started. I do remember all of the reviews, Cairo plus 5, the different PAI report cards, and they all kept stressing that after the pledging and the enthusiasm of the 1994 Conference on Population and Development, the money flow to fund the Cairo agenda was much less, and it was in fact very disappointing. So one of the issues running through the whole story is why is our case for getting adequate funding for this agenda, which is admittedly a much more complicated and ambitious agenda than earlier agendas. Why isn't that forthcoming? Actually, when I retired from the World Bank and got into training with the World Bank Institute, we started to develop a course that looked at these issues. I was one of the victims a couple of years ago when we did it, and we continue to do it. In fact, I'm off to Addis Ababa day after tomorrow, where we're doing it with the help of the Packard Foundation in Ethiopia. But there, as we focused on poverty reduction, reproductive health, and health systems reform and financing, one of the things that becomes quite clear is that the ways of doing business, and that includes funding, have really changed kind of in parallel to the changes that came with the Cairo agenda. I remember at the bank being asked when we started advertising reproductive health rather than population, someone said, well, where is the reproductive health window going to be for project fundings? And I says, well, the good news is that there may be more funding, but the bad news is we've moved away from projects and toward much broader program or sector-wide approaches. And so the way in which funding of initiatives was to be done and is being done, and increasingly so over the past several years, has really changed. In fact, it's got even more fuzzy with the so-called poverty reduction credits, which are multi-sector, not just health sector. And it began to puzzle all of us why, with all of that money out there, we weren't being more successful in getting our hands on some of it for the population and reproductive health agenda. And one of the themes in the WBI course is that perhaps we're not making as strong a case as some of our colleagues, for example, in other sectors, especially the kind of named disease sectors, who've really come on with very strong evidence to demonstrate that poor health outcomes attributable to malaria or TB or HIV/AIDS really does undermine poverty reduction. And of course, we had all of this rich body of evidence from the demographic and health surveys showing that if you break down utilization and health outcomes by wealth quintiles, that in fact the reproductive health indicators were the worst in comparison with some of the other indicators. So one would ask, well, what about the relationship in the other direction? What kind of a story do we have to tell about the impact of these poor outcomes on poverty reduction? So that was more or less what motivated the interest, which happened to coincide with the dialogue that was being promoted by a couple of foundations, particularly the MacArthur Foundation and the Hewlett Foundation, to look at the population poverty development linkages at the macro level. And you're probably aware of the work that's been done by David Bloom, Meg's cousin, Andy Mason, and others on macro linkages. Basically, that fertility declines in East Asia created this demographic bulge or potential bonus, that cashing in on the bonus required more than just the demographic window of opportunity. It required good economic policies. And, of course, then the obvious question, well, if these good demographics helped East Asian countries get an extra boost of economic growth, what about at the household level? Is there a household level parallel? The demographer in me cannot resist the temptation to remind you that in terms of the demographics, the age structure effects before this transition are the red lines out here. At the end, you get this very even pyramid, the green. But what people often forget is in between, that is during the transition, it's not simply an even shift from the red to the green, and you get this period in the middle where you get a bulge in both the working ages and in the reproductive ages, and that's where the link at both the macro level and the household level are likely to be turning up. So we started thinking, well, what can we learn by taking a closer look at the household level evidence? So reminding us that these bonus turning the potential into actual growth required some of these economic policies. We said, what about the other policies in health, reproductive health, and population? We also found a lot of skepticism about the macro arguments. People were questioning whether the macro story was really something that was simply East Asia. A lot of questioning why it didn't work in Latin America. And they came back and said, well, the economic policies were not as good, but a lot of skepticism about the applicability in Africa. And then the issue of whether or not, even if you get a bigger macro pie, whether the distributional issues are being addressed. And we felt that that was even more motivation for looking at household level evidence to convince some of the skeptics that the Cairo agenda could actually help in poverty reduction. So anyway, we, as I said, we took a look at these data from the demographic and health surveys that the poor get less care. These are two indicators: antenatal care, skilled attendance. Family planning in most countries is like this, although outreach programs like Bangladesh have helped to actually tip the scales a bit in favor of the poor, more than, for example, with antenatal care. So we turned our attention to the question, do poor reproductive health outcomes keep households poor? And we started looking at the general literature on links between health outcomes and poverty. That is, the potentially causal impact of poor health outcomes on poverty. And we found not much direct evidence. That is, where you could say, take a specific reproductive health outcome, and I'll get back to that tough question of what is a reproductive health outcome, and link it to, say, income poverty. So we then found a lot of potential indirect linkages and started assembling the evidence. And we did an extensive literature search. And our pile of papers, if we would ever print them out, fortunately there are PDF files, so you can assemble them electronically, but we ended up with a huge pile of material and then asked ourselves, what are we going to do with all this? So like many people, we said, well, let's sort it into smaller piles. So we decided that we would try to find some logic for sorting our materials into piles, both vis-a-vis reproductive health and vis-a-vis poverty, and to try to make some sense out of that, we borrowed a framework from the more general literature on health-poverty linkages. And I know it's busy, and I tried to make it as big as possible. But here is one illustration of it, taking a specific outcome that we're looking at, which is adolescent fertility or early childbearing, and then suggesting that if you try to match it up to some of the conventional thinking about poverty, say defined as either income or consumption. You need to work through the health linkages. You need to work through household resources and management, through education, particularly of mothers and children, and through the follow-up consequences in adult illnesses, malnutrition. And then all of that feeds into the macro level story, or we would expect it to feed into the macro level story, and then that there are a lot of contextual factors at the beyond the household level that also shape this. So that was our kind of organizing framework for building these stacks of papers, and we had to deal with the tough question of how do we measure reproductive health outcomes. And of course, back when we were looking at population and development linkages, we had fertility. And we could track through from fertility through age structure and kind of move fairly rapidly beyond the definition. Here, the story is much more complicated because we were dealing with a whole list of potential outcomes that we were trying to capture. Anyway, what we decided to do was sort our materials into 3 stacks. The first one being early childbearing, adolescent fertility, that whole cluster of questions. The second was maternal health outcomes, including maternal mortality and morbidity. And the third was an even bigger stack relating to family size, unintended pregnancy, birth spacing, that rich body of literature that has grown over the years as a result, for example, of the investments in the DHS surveys. Now, we had a lot of trouble deciding which pile to put things in because a lot of the research would relate to more. So we tended to try to find the core story, but recognize that there was clearly overlap and duplication. So we ended up, as I said, putting it into those 3 stacks from the point of view of the reproductive health outcomes. We also had to cope with the many dimensions of poverty because there's a parallel set of issues about how do you measure poverty. The World Bank's World Development Report last year got into a lot of these issues. There's income poverty, where you look at the income of the household, but you could also look at expenditures, you could look at consumption, you could look at assets and wealth, or you could track even further into Amartya Sen's call for a capabilities approach where you include health and education and empowerment and gender equity in your definition. So we were struggling with that definitional issue as well. So just to give you a preview of what we found and then to walk through some of the specifics, we found that the health outcomes, in all 3 cases, the evidence was strongest. And Meg reminded me on the Metro coming over, when we say strong evidence, we're not saying that the linkage isn't there. In fact, the common sense would tell us that a lot of these linkages are probably there. Our question was, how strong is the evidence base to support our argument that poor reproductive health outcomes somehow or other undermine poverty reduction? And as I say, if you look at the health outcomes or the health impacts, there is a fairly strong evidence base for assertions that, say, early childbearing, if you're careful, track through to higher incidence of abortion and therefore unsafe abortion, low birth weight, health problems that last on into adulthood, and so on. Then as we move into schooling, the other big cluster of consequences, there's some good evidence, but it's a bit disappointing. And in fact, when we looked at early childbearing, we thought, gee, it's a no-brainer that early childbearing should disrupt schooling, have outcomes. in schooling of both mothers and children where they are disadvantaged compared to mothers who waited or spaced their children. We didn't find as much as expected, and in fact, if you look at the paper, we turned to the U.S. literature, where we found an equally vexing set of conundrums about that relationship. And it turned out that context really mattered. In the U.S., it was the welfare system. In Africa, it turns out to be fosterage. So you get a lot of intervening social processes that make the relationship less predictable than one would think. And then when we turned to well-being, which was our grab bag for household production and consumption, we were really disappointed in what we didn't find, or what we found. We didn't find very much. Occasional bits of evidence about labor force participation, about productivity, a bit more on gender relationships, because we found that gender relationships within the households were affected by reproductive health outcomes, and then if you work through the gender channel, you found some of these linkages. Anyway, just a preview of the findings, which are laid out in excruciating detail in the paper. Now, when we looked at early childbearing, this slide just goes into some of the additional evidence on early pregnancy and lifelong morbidity, and we've got these tables where we summarize the research approach and the findings. Education, some evidence on dropping out, but when we looked at causal data in the reported causes for dropping out, for example in DHS, pregnancy was not at the top of the list. School fees, poor performance, competition from, say, needing girls to be at home to care for siblings were higher on the list than pregnancy. And when we talked about this with our colleagues, they said, well, remember, when schooling isn't available in the kinds of societies where you're looking at this, you wouldn't expect to find as strong a relationship, say, that you would find in the United States. And then in terms of well-being, we found more in Latin America, where there's a bit more rich literature. Myra Buvanich, who is now the gender advisor at the World Bank, did a very valuable review of Latin American evidence and found some good relationships, in part because marriage age is later in Latin America, so that an early pregnancy outside of marriage turns out to be more disruptive than it would be in Africa or Asia, where early childbearing and marriage are more closely linked, and then you get the health impacts, but less so the well-being impacts. Then when we looked at maternal morbidities and mortality, again, some evidence, although most of it anecdotal, that is anthropological evidence where you had people who went out and interviewed households that had lost a mother and found adverse impacts on the schooling of children, on the well-being of the household. But a disappointing lack of information on how maternal poor health, whether morbidity or mortality, was affecting households. We found one study. In fact, it was using Mexican data. Paul Gertler at the World Bank and colleagues had actually looked both at Mexico and Indonesia and found that it impacted on household decision-making, again through the gender channel, that when you lost a mother, the quality of household investments, say in education of children, on health of children, shifted. So that particular pile of papers was the leanest pile, at least in that one. On the other hand, when we went to unintended, mistimed pregnancy, high fertility, again, we found a lot more work. The work on Bangladesh, for example, the coming out of MATLAB, coming out of some of the Bangladesh Maternal Health Survey. We found a literature on unsafe abortion and unwanted pregnancy. In the case of education, again, as I mentioned, it worked through the kind of the gender channel, as it did in the case of well-being. So strongest on health, in some cases good material on education and well-being, but again, not as rich an evidence base as we would have hoped for. So what did we find? First, let me mention some common threads that we felt ran through a number of the studies. One is that context really matters. In the case of the adolescent childbearing education link, the whole question of fosterage. Fosterage tended to mitigate the adverse impacts in societies where fosterage was common. Market conditions in Latin America, in a study that was done for this book, Population Matters, that Nancy Birdsall, Steve Sinding, and Alan Kelly edited, a study by Ricardo Hausman and Miguel Zelke, reviewed using pairs of DHS and living standard measurement surveys, went through the linkages between number of children in the household and labor market participation, and found that it was labor market conditions, the openness, the wages, what jobs were open to women or not, that actually turned the direction of that relationship positive or negative. So again, an example of the contextual factors. Kind of echoing the macroeconomics, demography mattered. The stage of the demographic transition. You don't find much in countries or groups of households in countries where not much is happening in terms of fertility decline. Fortunately, there are fewer and fewer cases, but there are still African countries where you just, you run things through the filter and nothing is happening. Where you do see more important impacts is in the later stages, in that bulge stage of the transition that we saw for the macro. A second theme is that causality. Let me just summarize the three. The next slide just repeats what I just said about the context, so I forgot I'd made an extra slide explaining that. The causality problem is a big one, and it's particularly important in our dialogue with the economists. We did a review of poverty reduction strategy papers, which are the guideposts for the poverty reduction credits. The bank just announced the 5th credit for Uganda, and for the first time it mentions population and reproductive health in a poverty reduction credit. But the review that we did both at the bank and then UNFPA did one when the first round of poverty reduction strategy papers came out, found next to nothing on either the macro or the household level linkages between population, reproductive health, and poverty. And when I would approach my economist colleagues, they would say, well, where's the evidence? What can you tell us? What can you bring to the table? And we had to confess that we couldn't bring very much. And then what we brought was questionable in their minds in terms of the causality, because while we could find associations, as we did in the DHS data, between a poverty indicator, say those wealth data, and reproductive health outcomes, we couldn't say whether it was poverty that was causing poor reproductive health or poor reproductive health that's causing poverty. And they always remind us, you may remember that Robert Moffat article in Demography about a year ago, that there's always the possibility that there's a third set of variables or variable that's causing both, the labor market conditions or the lack of schooling. So it makes the story a lot more difficult to sort out. So that led us to our recommendations, both in terms of content areas that we need more study, particularly looking at mother's age and wealth status, looking at the experiences of young mothers over a period of time, not just a single cross-section, that we need more information on the effects of poor maternal health outcomes on the capacity of households to escape poverty. Some of you may remember the very large Giza study in Egypt, in Lower Egypt, that was done during the 90s, where they documented, as few have done, the reproductive morbidities associated with, say, poorly managed obstetric emergency. And I called both Huda Zarayak and Hoda Rashad, and I said, can you give me the stuff you did on consequences? And they actually sent me the book, the summary book on the study, and said, we ran out of money before we could look at the consequences, even though there's a lot of anecdotal evidence about those consequences. So we need a lot more of that kind of research at country level to track through. There's another, that fourth bullet brings in some economic jargon, but I hear this all the time from especially the economists who were assembled at that MacArthur-Hewlett dialogue process. You know, large households have what they call scale economies. You know, an extra child really doesn't take away from household consumption and in fact may add to production. And there's evidence, particularly on the gender side of this, that those who get shortchanged are girls. That, again, there's fragmentary evidence, but we need to push on that one a bit more. And then child spacing and educational prospects is another line that I'd like to see more research. So to build the evidence base and deal with this causality issue, we need analytical techniques. And now I'm coming back from academia, so you might expect a more research answer, but there's a lot of agreement about this at practical organizations like the Hewlett and MacArthur Foundations that can sort out the mutual causality issues. If you can find natural experiments like twin studies that were used in the U.S. early childbearing debate. And then to make a lot more use of what's called longitudinal data, where you can get multiple snapshots of the same family or individual over time. And we're actually now taking advantage of this Oportunidades Progressa evaluation work that's been going on in Mexico, where they have a conditional cash transfer program that has gotten very careful evaluation and also is really rich methodologically on getting at the causality issue. The Indonesia Family Life Survey is another example of this. And there are panels out there that either have or could have in a subsequent round more on reproductive health indicators. It happens that the 2003 Oportunidades survey has a richer pregnancy history and reproductive health module to it. So we're hoping that we can tease out more on the impact of early childbearing in Mexico, which is also a good candidate because it's a country experiencing rapid change but with a lot of inequality. Anyway, that kind of getting more mileage out of existing data sources. And as I say, those knowledge gaps on maternal morbidity is another that where you need the kinds of approaches, unfortunately expensive, like the Giza. So at the country level, we think that we would like to have more focused research, going beyond the cross-national types of review that we did, where you actually look at where the country is demographically, look at where it is in terms of social change, economic changes, and see if you can come up with a country-level story that would enrich the poverty reduction strategy process. And we emphasize that you don't need gold standard causal research in every case in order to do this. I don't take the answer that we get back that your evidence is not like the National Longitudinal Survey of Youth in the United States when someone says, can we do something? The work in Uganda that's informing is making the best use of existing data in Uganda to make the point that Uganda's high rate of population growth, the high fertility within households, really is undermining that country's chances of doing well with this enormous amount of money that's coming in through the poverty reduction credit. And so we think it's possible to link country evidence to this kind of international evidence and say, hey, if you look at a country where the gold standard work was done and use these variables, you can probably make a creditable case for including the reproductive health agenda in the work, in the funding for the poverty reduction credit. And that's more or less the story. And I think that was the last slide. No, bottom line, financing is falling far short, as I said. Resources can be mobilized. There's a lot of money out there, particularly in the poverty reduction credits and the sector-wide approaches. And to tap into those resources, the champions of reproductive health need to demonstrate, and I would say can demonstrate, that poor reproductive health outcomes undermine a household as well as a country's chance to escape poverty. And that was the last slide. Thanks a lot.
Jeff has asked me, am I on? Can you hear me? Jeff has asked me to go ahead straight away in the interest of time. I have a number of comments in some different areas that I'll specify here. I do want to first thank Jeff and the Wilson Center for asking me to come and comment on this paper. As these things often do, it helped motivate me to reread the paper, which is always an enriching experience with a paper that's so full of information. So that was quite a pleasure. I also want to thank the USAID Office of Population and Reproductive Health for supporting the Bridge project at PRB, which is what brings myself and some colleagues here as well as our interests in this topic. So I'll say a few things that I think this paper contributes, because it certainly is a major contribution. A few things that I think are missing. And knowing that legitimately Tom and Meg's response will be, well, do you want a 100-page paper instead of a 50-page paper? I accept that you can't put everything in every paper, but I'll mention a few things that I think still need to be considered and looked at. And then a few things that are sort of related efforts that may help inform this continuing discussion. So first, one of the things that it contributes is that the bibliography alone is very valuable. I have really augmented my to-read list, and I'll be sending our librarian off to collect a lot of the things that are on there that I haven't already looked at. So that's a heck of a lot of work, as we all know, and they've done a lot of work and have piles of papers, I guess, on their desk to show for it. So that's very valuable. The other main thing I want to mention in terms of contribution, I've divided into three categories. We have a much better understanding, thanks to this paper, of what we know and what we don't know. I think that's the major purpose of the paper, and they certainly have accomplished that in the specific areas that they deal with. I think it also gives us a much better understanding of what we think we know, but we don't really know. And I'll mention a few examples. And I think it also helps us understand what we know we don't know, as in we really don't know that, and we know that we don't know that. So we need to take a look at some of those things. And the difference between what we think we know and don't, and what we know that we don't know, is very important to understand for researchers and funders and program people. So a couple of examples of what the paper tells us that we know and don't know, and there are many, so I won't mention much except just some examples to illustrate that they have very clearly helped us understand some of these things. For instance, what we do know, that the risks of sexual behaviors are not just for unmarried women. The risks of sexual behaviors among young women are not just among young unmarried women. There are tremendous risks for married women and young married women as well. And I think that it's maybe easy to confuse that, and as the paper points out, focus a discussion on early births among unmarried women or early sexual activity, risk of HIV transmission, etc. It really isn't, a question of married versus unmarried, except in some specific respects. An example of what we don't know, and I think this paper helps us be certain that we don't know it, has to do with the major methodological issue that they address, which is this causality issue, the causal relationship between reproductive health and poverty, or you name the economic outcome of your choice. I think we know very well that there's a serious problem of how to handle endogeneity, even when we do try to take account of confounders by including appropriate variables. There's a great risk of overstating the relationship. We see some correlation, and we are tempted to overstate that relationship between the dependent variable and the independent variables, and then in turn perhaps imply to policymakers who care about these things that relationship would persist if policies adjust those independent variables, and that's a big problem, and we have to be careful of it. As Tom, I think, quite already eloquently described, there are some methods trying to take account of unobserved variables, and in some of this work, in the paper, they've looked at some work having to do with twins and other ways of trying to account for what might be called instrumental variables, bringing instrumental variables into the methods, trying to account for heterogeneity and preferences. This is a huge area needing a lot of work, and I'll make a comment related to my past life at NIH. One of the things I did there was to develop and manage a program called International Studies in Health and Economic Development. The purpose of that program was to try to dig more deeply into this problem, as well as the data problem that Tom already mentioned, to fund, and these are very expensive things to do, to fund additional longitudinal surveys and to fund the methodological development that relates health to various economic outcomes. More broadly, health more broadly defined than what we're looking at here, but otherwise quite applicable to this particular problem. And we funded additional rounds of research on the Indonesia Family Life Survey that he mentioned, work in Cebu, Philippines, and many of you are going to be familiar with some of those data sets. Those are very valuable data sets, but we certainly need more. So both in terms of methodology and the data, which I'll mention a little bit more in a moment, this paper helps clarify what the needs are. Okay, in the category of what we think we know but we don't, just a couple of examples. And there's some in the economic realm, some in the sort of cross-sectoral realm, and some related to definitional issues, as well as just certain of the topics. In the economic realm, Tom mentioned the intra-household resource allocation issue. We think we know that girls are disadvantaged in terms of intra-household resource allocation. We don't know that, actually. There really is conflicting work on that. I've come in the past from an agricultural background. It was practically, it was received wisdom that girls were going to get less food than boys. That, dad got most, boys got next, mom got next, and girls got the least food within the household. It's not true everywhere, all the time. And that kind of potential not really knowing what we don't know applies in this area as well. And so we need to understand that a little bit better. Another example in the economic realm, the impact of AIDS deaths, particularly among parents, on female labor supply, not just among parents, but we don't really know as much as we thought we did about that, as is pointed out in the paper. And there's a lot of work in that area, but we don't have good answers yet. Quickly, a couple of other examples in terms of cross-sectoral relationships, the relationship between childbearing and schooling. And Tom mentioned this, I won't elaborate on it. There's a great discussion of what the literature says, but I think where we come down is, gosh, there's country differences, there's other things that we can't explain, a lot of nuances there, and this is a very important relationship to understand better for a variety of reasons, including how we talk to policymakers about it. And then finally, one of the other issues where we think we know more than we really do, I think, is the relationship between attended deliveries and maternal mortality rates. I was fascinated to find out, I didn't realize that, in fact, that relationship, the assumption that there's such a close correlation between attended deliveries and maternal mortality isn't always true, as you point out. So that's, I think, very key. And we need to address that before we draw some conclusions from work. The final category, a few examples, what we know that we don't know. And those are the probably easiest things and the most challenging list. The demographic dividend. Where does it apply? Where will it apply? What needs to be done to reap the demographic dividend? A whole bunch of questions related to that. Macromicro linkages. As in a number of fields, we don't understand very well what those macromicro linkages are. We've got, nice theoretical models and ideas about what those should be, but again, hearkening back to my program at NIH, what we thought we knew, we really didn't, and we couldn't. There was a big gap between what we were getting, the micro level studies, and with the macro level studies. And I think here we may know a little more, but I'm not sure that we do. The roles of the behavioral versus the economic factors in, for instance, school dropout rates, which you discuss, and I think are very interesting. Again, context is important. We know that, but we don't know much beyond that. Another example that you mentioned very clearly, the effect of compressed childbearing and what that might mean for female labor supply and other kinds of economic outcomes. Okay, trying not to take up too much of the discussion time. What's missing? Again, recognizing that they can't do everything in this wonderful paper. I would have liked to see in those nice tables about the different studies and what the analysis of different studies tells us, something about the methodology used in those different studies, the data perhaps and the methods and how much confidence we have in those methods. So for instance, maybe you could divide those studies into the strength of the evidence, as you mentioned, Tom. Is the evidence strong, in between, or is it weak from study to study? Because that's kind of one of the key points here, is that there's a lot of studies out there, and there are people who think that this has been studied enough, but probably when it gets right down to it, it hasn't been. So we need to know which ones are good. Especially which ones use a random assignment method, or which ones are sort of gold standard and so on down the line. Another interesting thing, and I only thought of it when Tom mentioned this, would have been to organize the studies to use an economic typology instead of the health typologies, the reproductive health typologies, to divide your paper. Using an economic typology, how many studies tell us something about economic productivity? How many tell us something about women's labor force participation? How many tell us something about rates of return to schooling, or something like that? I mean, there's a number of economic variables of interest. Probably the studies, there's not enough to really do that, but it would be nice to, at some point, think about it in that way. Another couple of things about what's missing, discussion about within-country variation, and I don't know how much there is, again, if there are some studies that are looking at the sub-national level, where, of course, within-country variation can account for some of these data and method problems that exist. Maybe we can learn some things from that within-country variation. Effectiveness and cost-effectiveness of interventions. I mean, you didn't go there at all, on purpose, so this isn't a critique of the paper, but looking at what the interventions are and the cost-effectiveness of the interventions is very important. And I think we probably, again, mostly don't know. But what we do know, I think, is very important. And there are some things that we know that I think would be quite meaningful to policymakers and need to get out there, especially to economic policymakers, need to get out there more clearly to them. Finally, in the area of what's missing, sort of an extended look at the cross-sectoral effects. For instance, how does fertility relate to small and medium enterprise development or microcredit, aimed at women? How does that affect their fertility? There's been some work on that. It's good work, but it's not enough. Population, reproductive health changes, and public finance effects. How does that affect public finance and in turn make resources available more or less? Finally, my next and last category of comments, I want to say a couple things about the applicability of this paper and the use of the paper. And Tom and I discussed a little bit earlier kind of what their aim was in terms of the audience. I think it's aimed very well at a technical audience of people such as yourselves who are steeped in and knowledgeable about these issues, but recognize well that you need to know more about some of these relationships. It's probably not aimed at the general policymaker level. It's too long, as we all know, and again, it's not intending and not pretending to be something else, but it would be very nice, I think, to take the paper and pull out of it some key, clear points that policymakers, as well as a more general audience, might learn from it and put it into some forms, and without sounding too self-serving, because of course PRB and the Bridge program do that. I think that there's some room for that, and there's so much here that I think should get out to other audiences. The connection between research and activism, and I think this paper is very useful for thinking about that. I went back to a paper that Amy Choi and Ann Blank put out last year on I should give the exact title so that I'm doing them a service, The Dilemma of Past Successes, Insiders' Views on the Future of the International Family Planning Movement. A lot of people have probably seen that, and they point out several things in this paper, which is based on discussions with key informants largely, that I think relate, again, back to the work that Meg and Tom have done. One of the things is in there the point that to some extent this is too strong a word, but the abandonment of that's really too strong. Let me take that word back. The movement away from attention to family planning programs may be to some extent based on the inability for the lack of solid evidence on that relationship between population growth and economic growth. And they say, and I'll quote them, "There's appeared to be little solid evidence that rapid population growth was unambiguously associated with slower economic growth." Now, that's important, and I think, again, in terms of the research agenda, that point needs to be addressed to remotivate or re-energize activism in this area. Second point, I think the paper offers some better definitions of what is needed, for instance, in those countries where the fertility decline has sort of leveled off or where there's not much happening. Well, I think it probably helps us parse out what might be going on or what we need to find out, whether it's going on in those countries, to be able to address the problems in those countries. Again, a quote from Choi and Blank, people in that spoke to them said, well, the demand problem is largely solved. Or people know what's out there and it's not necessary to motivate them anymore. Well, I think probably a lot of people would disagree with that, but there's a belief out there that needs to be addressed, and I think the paper can help, again, focusing us on what we know and what we don't know can help sort that out. And then finally, almost finally, I think it can assist us in this shift of the reproductive health, family planning agenda to its ability to address poverty and other economic outcomes, along with MDGs, PRSPs, etc. This paper really helps move along that discussion, and that segues me right into the little commercial that I want to do. But this seems to be a paper that helps with the sort of repositioning notion, the repositioning of family planning. And again, Choi and Blank say many respondents feel the field has become less visible because important research questions have been answered. At the same time, they feel that little solid research is available on the benefits of family planning to buttress arguments for continued investment, and weak evidence on a link between population growth and economic growth, similar to the earlier quote. But I think what this paper does is say, look, we're going to address that that linkage. And that's, I think, part of the repositioning of family planning that people are talking about. So the final thing, I left a few flyers out on the table. Tom mentioned the Hewlett Foundation's interest in this work. There are some other foundations interested. And with Hewlett, Population Reference Bureau has just launched a new program, and will launch a different new program later on this year. The new one that has just been launched is to provide dissertation fellowships for people doing research on the relationship between reproductive health and economic development, trying to address precisely some of the questions that are raised by Tom and Meg, as well as raised by others that have been looking at this linkage earlier this year. These fellowships, there's, as I said, a flyer out there. The fellowships are available to students doing research in the United States on these topics, and I'd be happy to tell people anything more about that after the session or in email correspondence. The other program will be to fund centers of excellence at several U.S. universities to support research in this area. And both of these research support programs are intended to help address these questions, to help provide the evidence base to people such as yourselves and to policymakers, especially in the economic fields, to increase the attention and resources devoted to reproductive health and family planning. So I hope that we're successful in that. This paper certainly does help us along the way. Thank you.
Great. Thank you very much.
Thank you again to the Woodrow Wilson Center for giving us this opportunity to present our very dense work. And thank you very much, Rachel, for having the courage and sharpness to sort of extract some threads from it. When you write something as complex as this paper is, it's always interesting to see what it is that will grab the reader's attention. And I'm glad to see that you grabbed most of what we were hoping that would be grabbed from it. So thank you very much. I wanted to make a general comment first, that I think that, sort of stepping back from the entire project, that I think that there's a cautionary tale here in a way. I have a PhD in demography, and I got my training at a time when the reproductive health field was kind of fat and comfortable, and there was lots of money available, and I think that it was taken for granted essentially that there would be continued investments in this area and so on. And as Tom mentioned, that has changed for a lot of reasons. And I think that the cautionary element here is the need to clarify the relevance of reproductive health to the broader development agenda. In a sense, where we've been brought to a moment of, you could say, some degree of defensiveness in having to justify investment in this area. I think for many of us who work in reproductive health, it's perfectly self-evident. Unsafe sex and its consequences, rank very high in the global burden of disease. So we do take it for granted that this is a really important area in which to invest. But we're at a moment where we have to explain that to people who have a very different take on the development agenda. I probably don't need to say to this audience that obviously reproductive health is politically vulnerable in some respects. But I think also one thing that for me came up repeatedly in doing this review with Tom was that the HIV/AIDS field has done a much better job of making the linkages between AIDS-related morbidity and mortality and the impact on households. And I felt myself a little bit wistful once again at the kind of stovepiping that has separated the rest of reproductive health from HIV, because the investments are so many of the investments are the same or need to be the same. And I wish that we could go back a few years in time and kind of open up our arms and bring HIV and reproductive health more closely together again. I think I guess I wanted to respond to Rachel's excellent list of missing items from our paper, and it's absolutely true. There are a number of things. I think that the methodologies used in the studies is the most important area that we, in another lifetime perhaps might further develop. But actually what occurred to me, there's so many beautiful greeting cards that come out at Christmas time, and I was thinking of the three-dimensional ones, and I was thinking that if we included the methodologies in our already rather complex papers, we'd have to have pop-up tables so you could see the additional dimensions of the kinds of things that we need to include. So that's it for the moment.
Let me just add one thing. We actually did have that methodology table, but then we kept compressing the font size because there was so much that you had to say. And then we were also chickens because we didn't want to run the risk of saying somebody was only the silver standard and then having to meet them at the hall in PAA and say, yours was only a silver rather than a gold standard.
Anonymously when you do that one.
Well, terrific. Well, thank you all very, very much. Very rich report and very rich presentation of it and comments. So thank you all very much. We have a good amount of time for discussion. So I want to throw it open. We would like you to use a microphone so everyone can hear, but particularly the people on the web can hear what you're asking. And if you'd also let us know who you are and where you're coming from, that would be terrific context as well. So who would like to kick us off? Yeah, Susan, please, in the middle, right there in the middle. It's coming to you.
I'm Susan Wright. I'm with USAID Population and Reproductive Health. And I was very interested, and I was, of course, disappointed that the linkages weren't so blindingly obvious in real research as they seem to be in real life, but that's how it goes. I'm actually wondering whether you see the relevance of this kind of work and kind of approach to fragility and conflict prevention as well as poverty reduction. I think more and more we're having to justify our programs on a number of different parameters, and certainly the impact of demographic pressures on stability and on increasing potential for conflict is something that I think is another case that we have neglected to make. So I wondered if you'd have any comments on that. I'm not sure who I'm addressing this to at this point, probably both of all of you.
Taking anybody?
We didn't tackle it. Bob Engelman at PAI is the person I know who's, and then there's a program here, right?
Yeah, sure. No, I'll put Rich and Cotta from PAI on the spot in a minute, but just to do an advertisement. In the next issue of our annual journal, which will be out actually in a week or two, we have a 4-part series on demography and conflict that looks at it from a number of different angles, trying to get the researcher types to write in a policy-friendly language and find some of this stuff that's a little harder to find and make it more accessible. So we'll be sure that you get that, Susan. But Tom is right that PAI and Bob Engelman and particularly Richard Sincata have been looking at this and had this very useful and I think influential report, the Security Demographic, published last year. So Rich, would you do a thumbnail sketch of some of the key variables and the intuitive and the counterintuitive in terms of pop and conflict linkages?
Sure, thank you, Jeff. Well, we did this report here. We had quite a large audience listen to it, and since that time, we've had presentations at the CIA, National Intelligence Council, did NATO headquarters, and all of these have been invited presentations, and people have been very interested in the national security community. In fact, next week I go to West Point to do a seminar on it. So there is growing interest. It's a link that people in the defense community have always supposed was there, and the security demographic, all it did was take a look at the hypothesized variables, and we chose 4 that we thought were salient in the demographic literature. And the first one was what we call the youth bulge, which is a large proportion of young people, 15 to 29, in the adult population. And the second one was rapid growth in urban populations. The third was basically agricultural scarcity of fresh water and soil that has been hypothesized to be involved in some way in conflicts over these resources. And the fourth was looking at the demographic impacts of HIV/AIDS. In short, we found that the youth bulge had the most statistical relevance, you had the ability to look at the demographic transition in terms of the youth bulge and see actually a reduction in the likelihood of conflict over the last 3 decades if you staggered the populations according to their stage of transition. The other two were much weaker. Actually, the urban population growth is so highly correlated to the youth bulge that you can almost include them together. It's a little weaker. It comes out a little weaker statistically, but the two are just inseparable. You have very youthful populations in cities, extraordinarily youthful because of people's desire to come for work and for education. The land, water connection, the environmental security, very weak, very difficult to demonstrate anything. HIV/AIDS, weaker still. It was so very difficult to test at this point. You can look into the future and say, oh my gosh, look at the orphans, look at the poverty, look at the deterioration of a class of human capital, essentially. And you can really be frightened. And this case has been made very strongly, but to demonstrate that in some kind of coherent statistical fashion it's very difficult to do. And
terrific, Rich. No, I really appreciate it. I should also say, Susan, in the same next issue, we look with that focus on Nepal and try to understand PE population and environmental issues as where they play in terms of underlying variables in the insurgency and the instability there. And also, I think part of just as poverty and equity and reproductive health will be a focus of future meetings. We have in mind and would love to talk to you about ideas for taking individual quote-unquote fragile states or the kind of various along this categories and looking at particularly the population environmental underlying. So that will be something that we can do on a state-by-state basis. So look forward to those meetings. Okay, some other comments or questions? Yes, Eckhart, please.
Thank you very much for the great presentation. And my question is related, sorry, it was a great presentation. My question is related to the framework that you showed, and in particular the diagram of mutual causality or endogeneity that Rachel was referring to. And in the box that showed the contextual factors, what are the chances that we may be able to say something about the level of investment into reproductive health, meaning donor investments in reproductive health, but also public and private sector investments in public health? Do you think that we would find any relationship whatsoever on reproductive health outcomes, but also then on poverty levels? Thanks.
Anybody take a crack at that one?
In charge of tough question.
That one was easy, so.
Think about another one.
Well, this is, in a sense, Rachel's cost-effectiveness question. We ducked it. It's a tough issue, and in fact, in the grant that the Hewlett Foundation is making to the development research group at the World Bank, you may know that the 2007 World Development Report, the annual that the bank puts out on development topics, is on demographics, and in fact the demographics of the youth bulge. And the Hewlett Foundation made a grant to support some of the background work for that activity, and then is making an even larger grant to the development research group at the bank, which has on its general agenda this whole issue of effectiveness of investments in broad areas and specific areas, and one of the specific areas is in fact the impact of investments in reproductive health on poverty reduction and growth. It's a recognized gap. It's part of the more general concern about the effectiveness of aid, and gets you into all sorts of issues, whether it be corruption or capacity, the lack of capacity that we were simply not in the scope of this paper able to address. But a crucially important issue, again, for the poverty reduction strategies, one of the elements in addition to the poverty analysis is an expenditure plan that's results oriented, and having a base for deciding as the credits are being dispersed and implemented whether they're getting any kinds of results. So very important question, but we didn't tackle it.
Just to add a thought, because I think, Eckhart, you're also getting at the private sector resources, and the question about return on that. And just, first of all, the aid effectiveness issue, I think that's a very appropriate answer, and that is being looked at by the bank, and we'll learn some more about that in the area of reproductive health, I hope, before too long. But we were, for the Africa Bureau, trying to think of some ways that one might address the question that you asked, Eckhart, and the relative returns or effectiveness of different kinds of different sources of funding. We didn't come up with very good ways. I think there's an assumption that that private sector funding is more effective and public sector funding hasn't been as. I'm not sure. There's probably a number of different assumptions out there. But what we didn't do was come up with very good ways, given the data available, of figuring out how to measure that. So any suggestions are welcome, because I think that is a very key question, again, to be able to address some of the policymakers' needs.
Are there others in the room, since we have such a rich resource? There's a hand back there. Would you like to make a comment if you use a microphone?
Yeah, I'm Sunita Sharma. I'm from Futures Group. Scott Morland recently conducted a study of retrospective cost-benefit analysis. It's like 20 years data for Egypt. So he looked at, they have very good cost data, so that's different. You don't find that kind of data. But Egypt has very good cost data. He took into account that information, and also benefits, not in terms of how much money we saved, but in schooling and all those things, but also maternal mortality, morbidity, infant mortality, and all those kinds of benefits, like in terms of saving lives or reducing morbidity. He collected all that information. It's really useful. We are in the process of finalizing that paper. If anyone interested, we can send it. It's a very good tool, actually, to show how they're investing in family planning, how good it.
Okay, terrific. Other comments, questions? Yes, in the window well there. Yeah.
Hi, Sonia Zilberman from IUC and the World Conservation Union. This is a different question, not a comment to the specific question. My question is with regards to the natural environment and natural resource management, and if this report looked at the way that natural resources can have effects on reproductive health, specifically looking at the three groupings of health, schooling, and well-being. It seems like the environment may have a significant role to play with respect to water supplies, accessibility of fuel wood, and non-timber forest products, fisheries, and other environmental ecosystem services.
Clearly the natural environment is very relevant, but I think that our analysis, while we were faced with shortcomings in the limitations in the studies that we looked at, if you add the additional dimension of natural resources and sort of cross-tabulated with the kind of studies that we were looking at, I think there's very little evidence out there. I agree with you that it's important, it's an important backdrop, and ideally we would be studying it, but I think it's adds another layer of methodological complication, and I know of very few studies that have tried to bring all of these factors together.
I would also, as an additional resource, although on a slightly different question, but an analysis of the programmatic efforts to do linked population and environment programs. We had a very interesting session in this room in September with John Pielemeyer, who for AID and for the Packard Foundation have done an assessment of field-based programs. I believe that his presentation, those reports are on the Wilson Center website along as a summary of that. So for those interested in that question, particularly on the ground and how some of these efforts are showing results that are greater than the sum of their parts, or trying to really understand what's the difference between integrated programs and sector-specific programs, John's report is a terrific resource. Are there some other questions or comments? Yes, please. Gentleman in the back.
Maurice Middleburg from the Global Health Council. Thank you for a very, very interesting presentation. I have to admit it was disappointing after 50 or 60 years of research in this field to find that the results are still so equivocal, and we're asking for more research. And the question I want to ask is whether we're framing the question and the analysis properly. We're essentially trying to tease out the poverty alleviation impact of a single variable, reproductive health, albeit that it has many different dimensions. And I wonder if there's any other social or economic variable for which we could make a claim, if you move this policy lever, we will be able to see the following discernible impacts on poverty alleviation. And whether, if to some degree, we keep chasing the same hare, is there a gold standard out there that we can say, if we invest in program X, we know we're going to get poverty alleviation? And if we can't answer that for any other variable, are we in some ways engaged in a fruitless endeavor to keep chasing that hare with regard to fertility or reproductive health?
So holding ourselves to a higher standard than anyone else can do.
Well, Maurice, it's great to see you in Washington. We asked ourselves that same question because it would have been nice. It would be nice to be able to go back to our colleagues and the economists that we joiced with around these issues, and it became an article of faith at the bank 2-3 years ago that governance was one of those variables. And I went out and looked at their evidence base, and I must say that it would not stand up to the gold standard that is being put in front of us sometimes. In the health field, I think that the malaria people have done the best job in making the case for rolling back malaria on the basis of both the impact on the impoverishment effects of malaria and on the potential poverty alleviation impacts of reducing malaria. I mean, that is impressive, what those folks have done. And I guess I said to myself, I think we could do that, and we don't need to they're using the same kinds of data that we could be using. But for some reason, I think our field got overconfident and wasn't scrambling as much as some of the other health subfields were doing. And I think we're paying for it.
Just briefly, I think beyond the health field, it's pretty well accepted that investment in girls' education gives very strong returns across a lot of differing localities and contexts. I think there's less debate in that area than there is in this. And in agriculture and rural development, certain types of investment in rural development, I think there's pretty good research, strong evidence base to show that the returns are very high, and that directly links back to poverty in many countries where the existence of poverty is primarily a rural phenomenon.
But let me just say, Rachel, I think I dialogue with Paul Schultz a lot. And Paul is one of these people who insists, who's methodologically a purist. And even Paul, who would have taken that position on education 5 years ago is much more cautious today. They've got a new word they use, conjecture. You know, when they can't be sure its cause, they conjecture. Because, you know, that same set of lines between girls' education and reproductive health outcome, they would never admit that it worked the other way. And I think we could at least we have raised questions in their minds that more than just investments in education are involved in the effectiveness of that clearly highly productive investment. Nonetheless, there's a lot more going on than I remember Larry Summers, you know, batting us over the head in the late 90s when we were making our assertions about fertility, family planning, and outcomes. And he just came back and clubbed us with education, and, you know, all the economists kind of smirked. They can't do that these days.
Yeah, in response, Tom's absolutely right. There is, I think, a backing off, and I think it just reveals what we sort of all know and acknowledge but have trouble grappling with in research, that it isn't a single phenomenon or a single type of investment generally, and that's what makes it hard for researchers to handle.
Back to those integrated programs, right? Yep. Are there some other comments and questions? Dick?
Thanks. Dick Smith, State Department. When I worked at the National Intelligence Council for several years, we did a fair amount of work, and with you, Jeff, on population and some of these questions of conflict and other issues. And one of the sort of overarching confounding factors was the differences in governmental capacity. That's why I think the U.S. government moved towards a capacity building approach in many areas, and the challenge program are looking at that. Because even if you take something like the youth bulge, which in a country that has high unemployment and a badly managed economy and not good governmental structures and effective government, it can be very damaging and disruptive. But in a country that has a well-managed economy and well-managed government, that same youth bulge can be a real asset and a benefit. So it really, I don't know how you get a handle on that, but some looking at the context of the kinds of governments and societies you're looking at has to figure in there somewhere, because the same factors can just have completely different implications.
Yeah, and as Tom mentioned, the context is critical, right, for these practices. Any other comments?
I could add that, I hate to keep referring to my colleagues at the bank, but Danny Kaufman at the World Bank Institute has actually put together this set of about a half dozen governance indicators. And in another paper, I actually tried to see what the linkage was between a number of these multi-cross-sectoral issues and maternal mortality outcomes. And in fact, governance, using, they have indices, turned out to be one of the really critical variables, particularly in the cases where maternal mortality ratios were higher than you would expect, other things being equal.
Mm-hmm. Tom, could you or Meg expand on how this paper and this research has been received by your economist colleagues at the bank?
Well, friendlier than I expected. I think there's new management in the development research department. Of course, the Hewlett money doesn't hurt. But there's quite an open, there is a now a research program starting out, and Beth King, who you may remember, Elizabeth King was one of the early contributors to this field, went off and worked in a number of other areas, and now is coming back to lead this research initiative. So the hostility that was there when Lant Pritchett and that gang were ensconced is gone. And as I say, the new management has helped, the new chief economist has helped. And there's more openness now, and I think the paper was well received by them. It came at the right time in terms of the work that's being done in this World Development Report. So pleasantly surprised.
And could you also, you mentioned in what was a very interesting aside about how the new tranche of money for Uganda for the first time mentioned or had reproductive health in it. Is that something that's just Uganda, or are you seeing it in other country level programs?
Niger also, and this is thanks to John May, your former colleague at the Futures Group, who's been with the bank and working stalwart work on country assistance strategies and poverty reduction strategy team. The folks who work on this at the bank are few and far between. So it's been a very strategic approach of infiltrating poverty reduction strategy teams. You basically offer your services, and then it just happened that the Ugandan government, which up to just a couple of years ago, was just, they weren't interested. In fact, if you remember Museveni saying, we need more people. Well, you remember, Rachel, we had that meeting 6 months ago, and we almost fell off our chairs when we heard that the government of Uganda was asking for this research. So it was a combination. I don't know what finally led them to do it, but the bank team was ready when they did.
Okay, some other comments or questions? Oh, I'm sure we have some more comments and questions. So many smart people. How about I'm going to put some colleagues on the spot then. How about some of our colleagues from AID in terms of, Mike, could you tell us about how the poverty and equity and reproductive health efforts are shaping up there, and where you hope to see some of this work going?
Well, I'm actually very curious to hear, based on the outcomes, in terms of how, we talked about needed research.
Okay, I'm very curious to see, or maybe if you have any suggestions, rather than waiting years for more outcomes on the research side, how we can use the information from your paper and possibly other sources to kind of advocate at this stage along the lines of, maybe Tom, you mentioned the work done in malaria, or on the repositioning efforts to get this information out there. And I think one of the best examples maybe you gave is what's happening in Uganda. They use country-specific information. I think sometimes that's where the story is at. We can't generalize and maybe see worldwide patterns, but if you look on a country level, we might really have a rich source of information for addressing some of these issues in a more detailed way.
I just comment that the program that Rachel mentioned at Population Reference Bureau is an outgrowth of one of the consultations that Hewlett funded over the past 18 months with Nancy Birdsall's group at the Center for Global Development. And that group, which was heavily laden with economists, so if you look at the report, it's fairly typical of what kind of the old school says about things, very cautious. But it didn't deter some of the folks who said at least it's an opening. And Hewlett really plans to invest very substantially in country-level capacity building, particularly in Africa, using this Centers of Excellence concept. And I think there's money the first year for 3 grants, and you know it better than I do, will pair sister institutions. Isn't that the idea?
Right. There will be money directed at institutions in Africa, as well as money directed here in the U.S. And in Africa, there will be pairing. And so they're looking to do institution building, further data development, as well as sort of general new research outputs.
And I think one of the reactions, I mean, the kind of the economist crowd in that Hewlett consultation were all calling for additional panel surveys, and the Hewlett management was saying, we can't afford to wait for the 10, 12 years that you really need to get the payoff from that kind of thing. Can't we find more imaginative ways of using existing data? And that would include some of the innovations that have been done with the DHS data, and USAID has invested enormous amount of money in the DHS data and certainly the work that was done on the wealth quintile kind of extension of DHS was highly productive, and it might be worth looking at other ways of, say, combining, where you have 2 or 3 DHSs in a row, to either use, I'm not a survey statistician, but you might be able to tease more out of those existing surveys. And the same is true with the living standards measurement surveys that the bank has funded. In fact, some of the work, for example, in Tanzania on HIV, AIDS, and malaria used living standard measurement surveys that were not intended for that purpose, but there was enough there that kind of creative people could go back and squeeze more out of it. And I really think that that's the way to go, so we don't have to wait 15 years to get the results. I think we can get a lot of mileage out of what we got.
Eckhart?
My name is Eckhart Kleiner. I'm with the USAID, the AIM activity. I was just wondering, what's the interest from the UN community, especially given the fact that we don't have a reproductive health target among the MDGs? Have they been interested, in which way?
Well, I work very closely with UNFPA, and I know they would love to have more on this. And one of the world population, State of World Populations, actually focused on this topic. And Stan Bernstein, who's a good friend of mine, worked very hard to again squeeze the rock to get more information. But it was limited. They would love to be able to make that case to strengthen, particularly in reference to the Millennium Development Goals. And that's a long, sad story of why the reproductive health goal was the 9th goal. If you go back and look at the Stockholm conference, excuse me, not Stockholm, the Copenhagen conference +5 had the international development goals, and there was a goal on reproductive health, and then the Millennium Summit, was one goal less, and it was the reproductive health goal, and you probably know it was the abortion issue that got it knocked out. And it is hurt because, again, the other Millennium Development Goals have become real markers in, for example, at the World Bank and in the UN system, and it hurts us not to have that. They tried last year at the Millennium Summit last fall to bring it back in. I think the best they got out of that process is some recasting, not of the goals, but of the indicators, and that work is still going on at the staff level.
Terrific. Well, this has been very stimulating. You have given us, you've helped us with the review of so much literature, but you've also identified so many questions for future research, and Rachel helped us in some ways, particularly highlight what we think we know, what we don't, which seems to be the most critical, to have a sense of where we're misplaced confidence. I want to end with the challenge to us all to kind of think as we go forward about what I think was really a fundamental message that Tom opened and closed with, which is the notion that of kind of insulation and comfort level within this field that has perhaps inhibited our efforts to take the extra and often hard and difficult and out of our comfort zone steps of linking these issues to other issues such as poverty, such as environment, and certainly we've talked about the separation between reproductive health and HIV, and I think those barriers were thrown up by perhaps both sides, and it's certainly a two-way street. But that this seems to me to be quite critical in the current political climate, that we all think very hard about moving outside of our comfort zones to both learn more about other topics and the links of these issues to other topics and other people. And certainly this is something that is at the heart of what we're trying to do at the center, So we are always looking to all of you for ideas as to how we can do that productively. There are obviously many, many opportunities to do that, and we need to be, in some ways, choosy about how we spend our time, because, of course, it's hard to get smart about other fields altogether, and that's really what we're asking ourselves to do. But I take that away. I take away from your very comprehensive review of what you see out there. I take that lesson to heart as a real challenge to all of us to have that ambition, and I think it's both important from the practical sense of improving the outcomes we want to try to achieve, but also from a very pragmatic and practical and political. These are links that we need to do in order to have constructive dialogues with communities that have a lot of say in terms of how we spend our money in the larger development agenda, and frankly, broader foreign policy and the whole wide agenda, that we need to have some of these links, both for improving our thinking, improving programs, and surviving, frankly. So I urge us all to take on these issues, and we welcome your input and suggestions as to how we at the Wilson Center and some of our colleagues and cooperating institutions can do that. So thank you all very much. Please join me in thanking our three panelists for today's discussion.
Good paper, but it lost some of the message got lost in the advocacy side. It turned out to be a good advocacy piece.
Do that, and maybe I could jump on and have coffee. Yeah, exactly.
Hi, how are you? Good to see you. How are you?
Yeah.
I was just going to say, I haven't seen these yet. Good timing. Yeah, yeah. I'm glad you came up with other questions. Sharing. Yeah, I'm going to put this out
Here's ones we want to make sure you have. Good names. So, obviously.